Hi everyone. So again, me, Lorena Montes, here at ECS Club Meeting 2025 in Cincinnati. Now we have this interview with Sloane guy from the Georgia Heart Institute. So hi Sloane, how are you?
Good afternoon.
Welcome to CTSNet. And I just wanted to ask you, so you are doing robotics, right? You're a cardiovascular surgeon in robotics.
Yes, I do a lot of different types of surgery, but my primary professional focus for most of my career has been the development of robotic cardiac surgery.
When does it started? How did you do it? A little bit of your training.
I was very lucky in my training. My training in general surgery really spanned the evolution of minimally invasive general surgery. And then when I finished general surgery training and went into cardiothoracic training, it was right at the time that the robotic system was in trials and soon to be FDA approved. I was at the University of Pennsylvania, and we were doing robotic surgery at a fairly rudimentary level at that time, but this was the first generation. Really took a very keen interest in robotics. I'm kind of a gadget guy. I like gadgets and machines and robots. That's part of how I got interested in cardiac surgery, because the heart-lung machine, to me, the robot just seemed really cool at first. That's really what attracted me in the beginning. Although, honestly, I had doubts about it in the beginning, because it was a time where the robotic system was not as advanced as it is now. We were still making fairly big incisions to do the robotic procedures. But then things started to change over the course of my early career, and then I became obsessed with it.
As a gadget guy, as you said it yourself, so you're very much into tech and technology and all of this, with this boom of robotic right now, because you said it, it's been a while in the market, some robotic systems, but right now it's like we are in a boom of robotic systems and of robotic technology. So I know you actually give some talks about this, so I wanted you to explain to us, how is this boom? What do we have in the market today for cardiovascular surgery? What is going to happen? What is in trials? What is coming next?
Sure. Well, early in the evolution of robotics, there were two companies, Computer Motion and Intuitive Surgical, and then Computer Motion was acquired by Intuitive Surgical. And really for, over 20 years, there was really this one system, very good company, and now they're on their 5th generation of robotic system, and it's a great system. However, it's unusual that such a important technology would have only one company involved. A lot of those patents expired, and so that allowed other companies to get involved, along with a growing enthusiasm among younger surgeons for robotics and minimally invasive surgery. So as a result, I would estimate there's probably over 40 new robotic systems in development throughout the world today.
For cardiovascular or for everything?
For everything, for all specialties. Now, to my knowledge, there's only 2 robotic companies that have made a solid commitment to cardiovascular. One is Intuitive Surgical, and they have recently recommitted to robotic cardiac surgery, right? With the Da Vinci 5. They are pursuing an FDA indication for it, and also have committed to providing some of the tools that we need, such as the coronary stabilizer or the left atrial retractor, or perhaps some new tools that we don't even have access to currently. In addition to this, there's SS Innovations, which is a company started by one of our colleagues, Dr. Sudhir Srivastava, who was a partner of mine in Georgia many years ago. And Sudhir is a cardiovascular surgeon who made his name doing TCABs, or total endoscopic coronary bypass, with the robot. And he started this company in India. And I've actually done some cases with this new robotic system. And he and his company have made a strong commitment to cardiovascular surgery, obviously in part because he is a cardiovascular surgeon. I think there will be others. I would predict that companies like Medtronic, which is traditionally a cardiac company, will, perhaps Johnson & Johnson, perhaps others. I think we will see other robotic systems in great numbers in other specialties In our specialty, it might be 2 or 3, but eventually more, I think. It's going to be something that's clearly going to grow. It's already been growing since about 2016 at a rate of about 15% per year, meaning robotic cardiac surgical cases have been growing about 15% per year.
So right now we have Da Vinci and SSI Mantra, right?
Yes.
That's what we have in the market. And what do you think is going to happen, like for the perspectives for the future? Is Tesla going to make a robot? I don't know, something like this.
Well, my personal dream would be actually to convince Elon Musk to build a Tesla robotic surgical system. I mean, that would be just incredible in my mind. I don't know whether that's a big enough problem for him to be involved in, but I would love to have an hour with him convincing him of that. That being said, nothing's going to stop the evolution of robotics in cardiovascular surgery. I think that there's a number of things coming down the pike. One will be what's currently referred to as digital surgery.
Like AI or something like that?
Yes and no. As you perform surgeries at the lowest level, the robot is monitoring what you're doing. I mean, it's keeping tabs on your performance, and it will give feedback. Even today, I could pull out my iPhone, and I could tell exactly what my times were for the case I did yesterday. Okay, it would tell me when I docked the robot, when I finished the docking, when what instruments I used, et cetera, et cetera. It would compare me to my peers in terms of timing, et cetera. So that's sort of the lowest level of digital surgery, but there will be many, many other things. If you think about it, when you drive your car really is kind of like a robotic system, right? When you turn that steering wheel to the left, you're not really turning the car anymore. You used to many years ago, but now it's digital. You're simply telling that car to turn to the left, and it's doing what you tell it to do. And some cars like mine, I have a Tesla, can be completely autonomous. It can drive itself. And I think we will see autonomous surgery in some form. You know, there's recently been work done with gallbladder surgery at Johns Hopkins where they have been able to have a robot autonomously do portions of a procedure, you know, in large animals. And I think that will be sort of the first level, will be autonomous task. So say I want to suture 2 things together, I might draw that out or indicate that to the computer in whatever way we come up with, and then the computer will execute on that task.
I need the stitches to be, I don't know, 0.5.
Yes.
Well,
so there's things that machines do better than people, and there's things that people do better than machines. And I think that, for all the fear of robotic systems, it's really the human-robot partnership that actually produces the best result. Because again, robots can do things better and more consistently than we can for certain types of tasks. And so that's what we're going to see a lot in the development in the next 10 years.
And in terms of AI, what do you think that it's going to change in also combining all of this in cardiovascular surgery?
Right. So AI is obviously revolutionizing our whole society, right, at a very deep level, far beyond cardiovascular surgery. But when you connect AI to a robotic system, it can do a few things. One is it can allow that system to learn, even down to the level of learning an individual surgeon's, behavior patterns and how they throw a stitch or how they tie a knot or what have you. It can give feedback, right? That's another part of digital surgery would be to give feedback. I can imagine within 5 to 10 years, I might get a text at the end of the case. Dr. Guy, you didn't do so well today.
You were slow today.
You should have.
What happened?
Yes, what happened? Are you okay? And we noticed that your heart rate was a little high, or your heart rate variability was off, and we're a little concerned. Are you okay? I mean, really, I think that's coming. I think that AI could also allow the robotic system to do autonomous tasks that would not be possible with a hardwired, platform that simply says, well, you've got to put this stitch from A to B. As you know, in surgery, things are more fluid than that. and things change and things are variable, AI can make up for that variability and allow a robotic system to perform an autonomous task or a supervised autonomous task, more likely, in a way that would not be possible without AI overlaying the robotic system.
Okay, this is a very interesting topic. We could actually talk about that like a whole day. Is there something else that you want to add or say to our viewers that maybe can interest them?
My career has really been predicated on the pursuit of excellence in robotic cardiac surgery, and it's very interesting the resistance that I've seen over the years. There are literally people who hate the robot, very anti-robotic people, and I always laugh that maybe we need to have a softball game between robot people and anti-robot people to see who wins. But the truth of the matter is, and what is so enjoyable for me at this particular juncture of history, is the realization that nothing can stop the advancement of robotics, because all it does is it allows us to have more capability than our human hands. And what I tell patients is, well, okay, if I want to do open heart surgery the traditional way, I have to do it with these two hands. To get these two hands in the patient, I need an incision about that big, which is about the size incision we normally make, right? But the robotic hands are very small. I also think that a lot of people abandon robotics in cardiovascular surgery early on, when there was a first or even second generation robot. And there were lots of robots throughout the country that sort of sat in the corner and collected dust. But the truth of the matter is that those of us who have persisted, along with the companies, particularly Intuitive Surgical, are now seeing robots that are far, far more capable than the original robotic systems, and are able to do procedures that would not be conceivable before. I'm blown away. What's amazing for me is I've kind of been a leader in robotics and prided myself on being on the cutting edge, and yet I read things like a heart transplant at St. Luke's in Texas Heart being done robotically, or
in Dubai, I think it was a double pulmonary or something.
There's been a lot of major new operations that have been done. A transcervical robotic operation recently done at Cleveland Clinic. I mean, it's just astounding. And I think we're going to see a logarithmic growth in new procedures,
for sure,
of increasing complexity. So the day and age where the robot was very limited to P2 prolapse in a low-risk patient with mitral disease in the hands of a select few, maybe 5 to 10 surgeons in the whole country. We are now going to see a transformation where there's going to be new procedures being done. There's going to be many more programs opening up. Every week I see 2 or 3 new programs popping up in the United States, it seems, watching the news and hearing from people, and it just is remarkable, the amount of growth. And to me, it's unstoppable. Whatever people think about robotics, it just can't be stopped at this point.
Do you think the prices are going to lower a little bit with this boom?
Great question.
Because, I'm from Latin America, right?
Yes.
From Colombia. And our problem is basically prices. So
yes.
What do you think on this?
Without question. If you look at the history of technology, laptop computers. I bought my first laptop computer for, I think, $2,000, and it had, very little memory, very little capabilities. Now, fast forward to today, my watch has, thousands and thousands of more capabilities than that robotic system for a fraction of the cost. Just like we've seen, TVs go down in price, cell phones, you name it, whatever the technology is, the more companies that are involved, the more things develop, the cheaper it's going to become. And I do think that, the current cost of robotics is somewhat unsustainable, and I think one of the ambitions that Dr. Srivastava has had,
I was going to say,
with SS Innovations, one of his specific ambitions was to make robotics available to the entire world, not just rich countries.
Like India, like LATAM,
Yes, so that everyone can have the benefit of it. And the other thing that the increase in companies is going to do, besides just competition, which will lead to decreased cost, is it will increase the evolution of the technology, meaning competition will force each one of these companies to come up with something new, something different. A big part of that will be figuring out ways to make these robots cheaper and to sell them cheaper, without a doubt.
Yeah. So this was very interesting. So thank you for watching us. Thank you for watching this interview. Thank you for joining us for this interview. It was super interesting.
Thank you so much for having me.
So keep tuned and see you next.